Sure. Hi, Sharon. My name is Katie. Just wanted to chat with you a little bit, see what brought you in here today.
I've been feeling a little sad, and sometimes I feel like the world would be better off if I wasn't even in it.
Okay. How long have you been feeling like that?
For a few months.
For a few months. Okay.
Yeah, most of
Um,
it is since I've been going through my divorce.
sure. That can be really hard. So can I just ask you few questions about those feelings and just kind of see where you're at in regards to like safety?
Yes.
Okay. So have you ever um, wished that you were dead or wish that you could go to sleep and not wake up?
Yeah, kind of.
Okay. When's the last time you felt like that?
Last week.
Last week? Okay. On a scale of 1 to 10, where would you say you're at with how like strong those feelings are or thoughts?
Uh, Today, 4.
A 4? And is that pretty typical? A 4?
Sometimes it's an 8, and sometimes it's a 2.
Okay. And what makes that level raise?
What?
What makes it go from a 4 to an 8? What other different situations or?
Yeah, usually it's after I've talked to my ex-husband or when I get thinking about just not being married anymore.
Okay. Have you ever had any thoughts of actually killing yourself?
No, yeah, I guess I have. I've thought about taking too many pills or just driving my car off of a bridge.
Okay. So you've thought about doing those things. Have you ever done anything to make it so that you could do those things?
Well, I did go to the doctor and get a prescription for sleeping pills, but I didn't take them.
Okay. What did you do with the pills?
I still have them.
You still have them? Where do you keep them?
They're in a lockbox.
And you have the key to that box?
Yes.
Does anybody else?
No.
No, just you. Okay. Um, do you still think about taking those pills or do you have a plan to take them?
No.
Okay. Is there anything that would change that to where you do plan to take them?
I don't think so. I don't think I will take them. I do get sad, like I said, when I talk to my ex-husband, but now I realize that I have other family that would really miss me. So I don't really think I would ever do it.
Okay. When you're feeling sad or having those difficult times that kind of push that level a little higher, what kinds of things do you do to take care of yourself or help cope with those feelings?
Sometimes I go for a walk, and sometimes I go visit my sister.
Okay. So sounds like there's some suicidal ideation there and some thoughts about ways that you could do it, but no real plan or intent to do anything with those pills right now. Is that
That's right.
correct?
Yeah, that's correct.
Okay. So I think moving forward, just to help keep you safe before we meet again, creating a plan to kind of help cope with some of those feelings. So when things that happen that kind of push that level higher, you have a plan in place to help you cope with that. And you mentioned a couple of things that helped with that, going to see your sister, going for a walk. Is there anyone that you would try to give those pills to hold on to for you, or the box that they're in?
Yeah, I trust my sister.
So you could give them to her to hold on to, and that way, if things did get really bad, it would kind of give you some space between thinking, having those thoughts and feelings and acting?
Yes.
Okay. Okay. So we'll plan to meet again next week and kind of talk further about what we're going to work on and what we can do. And until then, if you're having any more thoughts or feelings or anything that's going to push that, level 4 up higher, that you'll go for a walk or call your sister. And then when do you think you could give those pills to your sister?
She lives close by, so I can give them to her in about 30 minutes.
Okay. So does that feel like a good plan for you and something that can help you kind of manage those thoughts and feelings?
Yes.
Okay. Okay, great. Well, let's try that, and then next week we can kind of talk about how that plan went and where your feelings are at and kind of go from there.
Okay, that sounds good.
Okay, great. Well, I'll see you next week then.
Thank you.
Great. Should I stop recording it?